Myasthenia gravis. It's a mouthful, isn't it? But behind this complex name lies a condition that affects thousands. In simple terms, myasthenia gravis, or MG as it's often called, is a chronic autoimmune disease. Imagine your muscles not working as they should. That's what happens in MG. The connection between your nerves and muscles is disrupted, leading to weakness and fatigue. This disruption is caused by the body's own immune system attacking healthy tissues. But don't worry, we'll break this down further. We'll explore the causes, symptoms, and available treatments. We'll also hear from individuals living with MG and learn about the importance of early diagnosis. Because knowledge is power, and understanding MG is the first step towards managing and overcoming its challenges. Our immune system is our body's defense force, protecting us from harmful invaders like bacteria and viruses. It is a complex network of cells and proteins that work together to keep us healthy. This system is incredibly efficient at identifying and neutralizing threats, ensuring that we stay safe from infections and diseases. But sometimes it can malfunction. Instead of targeting harmful invaders, it mistakenly attacks the body's own cells, leading to autoimmune diseases. This misdirected attack can cause a variety of health issues depending on which part of the body is targeted. In the case of MG, or myasthenia gravis, the immune system mistakenly attacks the connection points between nerves and muscles. This specific autoimmune disorder disrupts the communication between the nervous system and the muscular system, leading to significant physical challenges. These connection points are called neuromuscular junctions. They play a crucial role in muscle movement and coordination. At these junctions, nerve cells release chemical signals that are received by muscle cells, prompting them to contract and produce movement. Think of these junctions like bridges. Just as a bridge connects two landmasses, neuromuscular junctions connect nerves to muscles, allowing for the transmission of signals that enable movement. When you want to move a muscle, your nerve sends a signal across this bridge to the muscle, telling it to contract. This process is essential for all voluntary movements, from lifting your arm to taking a step. In MG, the immune system damages these bridges. The attack on neuromuscular junctions disrupts the normal flow of communication between nerves and muscles, leading to a breakdown in muscle function. This makes it difficult for the signals to get through, leading to muscle weakness. The muscles may not receive the necessary signals to contract properly, resulting in fatigue and reduced strength. This malfunction occurs because the immune system produces antibodies that block or destroy the receptors on the muscles that receive these nerve signals. These antibodies interfere with the normal function of the neuromuscular junctions. These receptors are essential for muscle contraction. Without them, the muscles cannot respond effectively to the signals sent by the nerves. Without proper communication between nerves and muscles, everyday tasks like smiling, swallowing, or even walking can become difficult. The impact on daily life can be profound, affecting a person's ability to perform basic functions and maintain their independence. This mistaken identity by the immune system is at the heart of MG. Understanding this process is crucial for developing effective treatments and improving the quality of life for those affected by this challenging condition. MG can manifest in a variety of ways, and its symptoms often fluctuate. You might experience periods of muscle weakness followed by periods of relative strength. This unpredictable nature of MG can make it challenging to diagnose. One of the hallmark symptoms of MG is muscle weakness that worsens with activity and improves with rest. This weakness can affect different muscle groups, leading to a range of symptoms. Some people may experience drooping eyelids, double vision, or difficulty speaking. Others might find it hard to chew, swallow, or hold their head up. In severe cases, MG can affect the muscles involved in breathing, leading to respiratory distress. It's important to remember that not everyone with MG will experience all of these symptoms. The severity and specific muscles affected can vary significantly from person to person. Diagnosing MG involves a combination of approaches, starting with a thorough medical history and physical examination. Your doctor will begin by asking detailed questions about your symptoms, such as when they started, how they have progressed, and if there are any specific triggers that seem to worsen or alleviate them. This initial conversation is crucial as it helps the doctor form a preliminary understanding of your condition. Your doctor will ask about your symptoms, their duration, and any patterns you've noticed. They will also inquire about your medical history, including any other health conditions you may have, medications you are taking, and family history of neurological disorders. This comprehensive history helps in ruling out other potential causes of your symptoms. A neurological exam will assess your muscle strength, reflexes, and coordination. During this exam, the doctor will test various muscle groups to see if there is any weakness or fatigue. They will also check your reflexes and coordination to identify any abnormalities that might indicate MG or other neurological conditions. Your doctor may also perform specific tests to evaluate your eye movements and eyelid strength, as these areas are often affected in MG. For instance, they might ask you to follow a moving object with your eyes or hold your gaze in certain positions to see if there is any drooping or difficulty in maintaining eye movements. Blood tests can detect the presence of specific antibodies associated with MG. These antibodies, such as anti-acetylcholine receptor antibodies, are often elevated in individuals with MG and can provide a strong indication of the disease. The blood test results, combined with the clinical examination, help in confirming the diagnosis. In some cases, your doctor might recommend a nerve conduction study or electromyography, EMG, to measure the electrical activity in your muscles and nerves. These tests can reveal abnormalities in the communication between nerves and muscles, which is a hallmark of MG. The EMG in particular can show a characteristic pattern of muscle fatigue that is indicative of the disease. Another diagnostic tool is the edrophonium test, also known as the tensilon test. This test involves injecting a medication that temporarily improves muscle strength in people with MG. If there is a noticeable improvement in muscle strength following the injection, it strongly suggests the presence of MG. This test involves injecting a medication that temporarily improves muscle strength in people with MG. The doctor will closely monitor your response to the medication, looking for any immediate improvements in muscle strength, which can help confirm the diagnosis. Diagnosing MG can be complex, and it often requires the expertise of a neurologist, a doctor specializing in nervous system disorders. The neurologist will review all the test results, clinical findings, and your medical history to make a definitive diagnosis. This comprehensive approach ensures that the diagnosis is accurate and that appropriate treatment can be started promptly. Section 5. Treatment Avenues. Restoring muscle function. While there's no cure for myasthenia gravis, various treatments can help manage symptoms and improve quality of life. These treatments are tailored to each individual, depending on the severity of their condition and their overall health. The goal of treatment is to enhance communication between nerves and muscles and control the overactive immune response. This can be achieved through a combination of medications, therapies, and sometimes surgical interventions. Medications often play a crucial role in managing myasthenia gravis. They can help alleviate symptoms and improve muscle function, making daily activities more manageable. Some medications work by increasing the levels of acetylcholine, a neurotransmitter involved in muscle contraction. This helps improve the communication between nerves and muscles, leading to better muscle control. Others suppress the immune system, preventing it from attacking the neuromuscular junctions. By reducing the immune system's activity, these medications can help decrease the severity of symptoms. In some cases, a procedure called thymectomy might be recommended. This surgery involves removing the thymus gland, which is believed to play a role in the abnormal immune response seen in myasthenia gravis. The thymus gland is part of the immune system, and removing it can reduce myasthenia gravis symptoms in some individuals. Post-surgery, patients often experience a significant improvement in their condition. Lifestyle modifications can also contribute to managing myasthenia gravis. Adopting a healthy lifestyle can support overall well-being and complement medical treatments. Getting enough rest, managing stress, and avoiding triggers that worsen symptoms are essential. Practices like meditation, yoga, and adequate sleep can make a significant difference in symptom management. Working with a physical therapist can help improve muscle strength and coordination. Tailored exercise programs can enhance mobility, reduce fatigue, and improve the overall quality of life for those living with myasthenia gravis. Section 6. Living with myasthenia gravis, a patient's perspective. Living with a chronic condition like MG can be challenging, but it's important to remember that you're not alone. Many individuals with MG lead full and active lives. Let's hear from Sarah, a young woman diagnosed with MG in her early 20s. At first I was scared and overwhelmed, Sarah shares. I didn't know how MG would affect my life, but with the right treatment and support from my family and friends, I've learned to adapt and manage my condition. Sarah emphasizes the importance of listening to her body and resting when needed. I've also found that staying active and engaged in my hobbies helps me feel more like myself, she adds. Sarah's story highlights the resilience of the human spirit and the importance of a positive outlook in managing chronic illnesses. Section 7. The importance of early diagnosis, a beacon of hope. Early diagnosis and treatment are crucial for improving outcomes in MG. The sooner treatment begins, the better the chances of slowing disease progression and managing symptoms effectively. If you experience any of the symptoms mentioned earlier, don't hesitate to consult your doctor. Early detection can make a significant difference in your quality of life. Remember, MG can be challenging to diagnose, as its symptoms can mimic other conditions. Be your own advocate and don't be afraid to seek a second opinion if needed. Section 8. Research and advancements, strides towards a brighter future. The medical community continues to make significant strides in understanding and treating MG. Researchers are exploring new medications, therapies, and diagnostic tools to improve the lives of individuals living with this condition. Clinical trials are underway to evaluate the effectiveness of new medications that target specific aspects of the immune system. Gene therapy, a cutting-edge approach that aims to correct the underlying genetic defects that contribute to MG, is also showing promise. These advancements offer hope for more effective treatments and ultimately, a cure for MG in the future. Section 9. Conclusion: empowering ourselves with knowledge. Myasthenia gravis is a complex and challenging condition, but with awareness, understanding, and the right medical care, individuals with MG can live full and meaningful lives. Remember, you're not alone in this journey. Support groups, online resources, and healthcare professionals are here to provide guidance and support every step of the way. By empowering ourselves with knowledge and advocating for our health, we can navigate the challenges of MG and embrace a brighter future.